Our next speaker, we're going to talk about brain injury now. So it's Sue Hillis, and I've had the benefit of knowing Sue for a number of years. We actually worked together a number of years ago. Sue's worked for over 25 years in the health system in the Southwest, including in-home services, long-term care, community support services, and in the regional office of the Ontario Ministry of Health and Long-Term Care. Sue's been the Executive Director of Dale Brain Injury Services since 2005, and tonight she's going to talk about services available for residents living with acquired brain injuries. So please welcome Sue.
So I have quite a lot of slides here, which I'm going to really skim through because I really want to focus on some of the new things that are happening for London and outreach and day program services in particular. There are copies of the slides over there, so if you want to take them after, that would be great. We do offer a lot of services, and actually we provide service if you remember back to the beginning of Mike's map of the Southwest Lynn geography, we provide services in that entire geography. So that is a huge area of land to cover. So as I said, I'm only going to talk mostly about what's provided in detail in London tonight. So, but just to give you a sense of, we do provide throughout the whole Southwest Lynn area. So just for people who might not be familiar, because often people are confused about what is an acquired brain injury, it is any type of injury that occurs to the brain anytime after 7 days of age. So that means that even at a very young age, a person can acquire a brain injury. Now, if they acquire their brain injury while they're under 13, they are still in the developmental stages as well, so they often will also have a developmental disability along with their brain injury. So often people aren't aware that both of those things can co-occur in a person. And people can get brain injuries from a wide variety. Often people think about brain injuries often coming from a motor vehicle collision, but you can get an injury to your brain from all sorts of different occurrences, both traumatic and non-traumatic. So it just shows you up there all the different ways that you might be able to get a brain injury. And just a couple of statistics. It is a very, very widespread occurrence. It's a very hidden disability often. People aren't aware when someone has a brain injury because they don't necessarily show anything on the outside unless they have a significant physical disability. So more than 100 a day in Canada, but unfortunately Ontario represents about 40 a day. So quite a high incidence here in Ontario. A lot of challenges come along with an ABI, cognitive, behavioral, emotional, and physical. So people can have a lot of things going on that really impede their ability to live their day-to-day life. And one of the things I really want to point out to you is that because we have limited resources and cover such a wide geography, what we really try and do is support people in whatever placement they're in. So rather than trying to bring them, for example, into our assisted living or supportive housing program, which has a very long waiting list, we would rather try and give some capacity building to the staff of wherever they may be, whether it's a retirement home, long-term care home, or with family members, or wherever they may be, homes for special care, other types of organizations in the community, community living, wherever they might be living, we're going to be trying to build capacity in those staff so they can support the people in that placement rather than trying to put them on our waiting list, which might take them years to get those kinds of supports. We do serve that transitional age youth, so all of our services support people 16 and over. Do have 2 streams of service, which is really important because often people think about brain injury as being people needing rehabilitation or recovery immediately following their brain injury. And realistically, we see people who need lifelong support. People who have challenges from a brain injury do often need lifelong support. They may go through periods where they're getting what we would call rehabilitation, sort of that more intensive, really specific goal-oriented skill building, but really that's a lifelong thing that people need. And so we have the 2 streams of service that we're providing. One of the things that's very key in our service that's different than a lot of other community-based services is we don't ever really discharge anyone. They may wander off and disappear for 6 months, tell us they don't need us anymore, and then they come back. And we always take people back. They always are a priority. So we don't ever actually completely discharge anyone. They're always able to access our service, and even if we haven't seen them for months or years, they can always call our on-call person which is available to them 24/7 to deal with any kind of crisis. So what we're really focusing on for people is these opportunities for skill development, opportunities to increase participation in their communities. So back to what I was saying earlier about capacity building, is what we really want to enable people to do is to take advantage of whatever services are available in their community. So if you think about London, we would try and make sure that people had the skills and abilities that they could work at, for example, Hutton House. I'm seeing Marilyn in the crowd over there. They could take advantage of Hutton House, they could take advantage of Leeds, the community courses offered through the Spectrum, those kinds of things. So our staff would support them so that eventually they would be able to participate in the community activities that are available to them. And as well, you'll hear from one of our clients' family members a little bit later, we do provide respite for caregivers. That's a fundamental function of what we're doing, because that enables that placement to continue to be successful. So to avoid caregivers getting burned out and to be able to help them better manage their loved one at home. So as I mentioned, what we're looking for clients, what we know from the literature is what people want in their lives. What they want in their lives is work, love, and play. That's what's most important to people. And so what we try and do with our clients, if you see on the bottom right, we're trying to work towards goals in those three areas. Wellness, and that from the total wellness perspective, physical, emotional, spiritual, as well as interpersonal, so building relationships, the ability to maintain relationships both with family members, with the public, even something as simple as, we always say, people think, your staff take clients to Tim Hortons. What good does that do the health system? So what are we doing? We're teaching people to be patient while waiting in line. We're teaching people to interact with the person either behind the counter, the other folks in Tim Hortons, to be able to build relationships and friendships with people, to be able to make change, to be able to manage their money so they can afford that coffee outing. So it's not as simple as a client and a staff person going to Tim Hortons. There's a whole lot of other things. So they're working on goals in interpersonal and wellness, knowing what things to pick at Tim Hortons that might not be those high-calorie cappuccinos all the time, that maybe you should have the herbal tea once in a while, and maybe you should have the bagel instead of always having the Dutchie or the Danish. So those kinds of things, it's not just a simple going out for coffee. And then, of course, the meaningful activity piece. So that comes with our groups and activities programs, our other day programs that we offer, as well as getting people involved in the community and the other things. So we do have services, as I mentioned, all across the 7 counties, and you can see up there what's there. And in London, what's important, as I mentioned, is that we have assisted living service, so a 24-hour eyes-on supervised setting for those folks who really will never live independently or who are working towards living independently. And that really, those activities that they're doing in there covers them as much as we possibly can. We also have a new program in London that opened a couple of years ago, which is a supported independent living apartment building called the Gobi Center on Albert Street, and that's 20 apartments where people live independently, and the staff are there just to help them out, not overnight, but they do live independently and have the problem solving, and people are able to be there and to go down to have the staff help them. They also have developed their own community in that building. They run their own group activities in their common area. They have breakfast club every morning that they run themselves, all that kind of thing. So day program is one of the things I wanted to focus on today. And we have day programs in London. We have 2 of them, which I'm going to talk about in a bit. But what we consider a day program could be any group of people who want to be together for 4 to 6 hours a day. And we run day programs all around Berlin. We have them in Lingham, Port Elgin, Woodstock, St. Thomas. In London, we're fortunate to be able to fill them 5 days a week. But in the other areas, obviously, we don't have the critical mass to have 5 days a week going. But there's always lots of different things that people can do in a day program, depending on the skills, needs, and abilities of who's in the program and what people want to get out of the program based on those goals that I mentioned earlier. We do have a clubhouse model day program. Some of you might have heard about clubhouse model programs before. Started in Manhattan, New York. Right after the war, a group of people with mental illness got together, developed their own clubhouse, managed to convince Medicaid and Medicare to fund it, and it is a clubhouse that's run by the clients. They call themselves members, and they're the ones who do all the activities to keep the clubhouse going. The staff are just facilitators. So we do have that clubhouse at the corner of Richmond and Oxford, and generally about 30 to 40 people go through there in a given day. A lot of this work that's done there is work-related, so people are trying to find employment. They're developing the skills to have employment or volunteer positions. So a lot of the folks who go to the clubhouse really are, they live independently or with families, so there may be some respite involved there as well, but mostly they're there to really try and find the skills to get work. We are opening a New Day program in August, and it will be at Earls Court, which is a new long-term care home opening on Highbury Ave. So some of you may have seen it going up there, just a little bit north of Montcalm. So we will have a New Day program in that building, and it will be for people who have much higher physical care needs than in our other day programs that we have in London. We will also be hopefully supporting the folks who are living in we're hoping to get a specialized ABI unit in the Kensington Village redevelopment. So people from there will be going to the day program as well from that unit, but it will also be for people in the community who have that higher care need than people in our other day programs. And it will be really a program that's designed by the individuals within that day program. Once we know who they are, we've got kind of a loose design happening now, but once we have the 20 to 30 people in there, then we'll be able to determine what that day program looks like based on the needs and skills of those folks. Just want to touch a little bit on outreach. Outreach is one-to-one or in groups, and it's really what the person needs, as I mentioned earlier, to maintain their placement in the community, to be able to live independently, to be able to learn how to manage their money, to maintain their housing, to do their grocery shopping, do their laundry, get along with others, all those kinds of things. Those are whatever they need, and outreach is what we provide. Individual counseling is also available from our clinical team, as well as education for them and their family members. Do a lot of leisure and recreation, going out for coffee, as I mentioned, which is not just about coffee. A lot of support in terms of volunteering as well, going to those spectrum courses. Outreach service occurs wherever the person is. That could be jail or some kind of detention facility. It could be the homeless shelter. It could be a retirement home, long-term care home. It could be, at first, we only meet them in the community until we find them safe housing where the staff is able to go in, all that kind of thing. So our outreach services can occur wherever and whenever the client needs it. We do also provide some consultation services. We have a full clinical team, and we provide consultation and training to people who need help to understand brain injury, to understand the specific needs, functional abilities, or challenges that their loved one has, or the person that they're supporting in their program. And we have certainly done a lot of work lately in the long-term care homes. And in fact, I'm speaking with the long-term care home group from London Middlesex tomorrow morning to talk a bit more about how we can solidify our partnership in terms of going in and helping those staff and those programs deal with people with significant responsive behaviors due to brain injury and other situations in the long-term care homes in the area. We do have Ontario Telemedicine Network available, so we do a lot of our consultation and training through the Ontario Telemedicine Network, so video conference, but we also do Skype. So our clinical coordinator and our clinical psychologist will Skype to family members in their home, to the clients themselves, or to whatever works for them so that they can really get along better with that individual. And again, I've mentioned our training services before. It's individualized based on the needs of the client specifically and their family members, caregivers, informal or formal, but also if we want, we can do sort of generic training. We have provided our ABI 101, so the basic training about brain injury, the challenges, behavior management strategies, that kind of thing, to all the addiction and mental health workers in Huron and Perth and Grey and Bruce. So now I'll target Don to try and get some more of his staff involved in this as well. Because I think it's really helpful, again, with that building capacity piece. We really want to make sure, because we all have limited resources, why have two case managers involved with a client? One for mental health and one for their brain injury. We really, if we can provide the capacity, provide consultation to each other, then we really only need to have one case manager for that client, and they're the ones who tap into the other health service providers. And the client themselves doesn't have to worry about that. The staff's looking after that for them. So before I introduce Michael Langley, I would just want to mention that as of recently, the Community Care Access Center has taken over our admissions intake and referral process. So they will be the ones who are doing all of that intake and referral, except when it comes to consultation and training. So if you want to access our consultation and training services, you can do so directly but in terms of referring a client for eligibility assessment and all of that, it goes now through Community Care Access Centre, London, Southwest. So, do you want me to take questions first or introduce Mike first?
Yeah, any questions for Sue before we introduce?
Sorry, I'm talking fast and going through slides fast because I want to give Mike time to talk, so he's much more fun than me.
Thanks.
Not setting you up or anything.
No, no.
Okay, well, I must have been either
Very thorough.
very thorough or stunned them all into silence. So Michael Langley is the father of Giles Langley, and Giles attends our day program and receives outreach services. And he received his brain injury at the age of 19 from a severe asthma attack, and that was about 25 years ago. So Mike and his wife have been caring for Giles since that time. And they moved to London, I think in 1997-ish, and so hopefully not too long after that, they found us, and we have been supporting Giles since that time. So Mike's going to share today a little bit of the story of Giles and the services that he gets from Dale.
I guess I shouldn't use the lectern.
It's okay if you're more comfortable.
I may do, yeah. I just don't want to hit too many buttons because I don't have my own view graph. Well, thank you. Good evening for inviting me. Thank you, Sue. For those of you who are unfamiliar with the challenges of caring for a person with acquired brain injury, and I don't know how many of you are, the challenges can generally be characterized as emotional, physical, and financial for caregivers. That's essentially what we deal with. And those challenges will exist, in essence, until such time as the caregivers can no longer provide the support that's necessary for that individual. And data from the US suggests that 50% of all families break up if they have a family member who has a brain injury. So there's quite a lot of trauma associated with the management of someone who has a brain injury. Now, generally, when people talk about facilities, they talk about Dale and the support that they provide to clients, and that obviously is correct and proper. But what they may not fully appreciate is how the attendance in such a facility extends benefits to the caregivers and to society in general. And that's what I'd like to talk briefly about this evening, as I've only got 5 minutes. Now, in order to convey how those benefits accrue to others beyond the client, you need to be a little aware of Giles's limitations and the support we receive. And Giles is unable to walk, unable to use his hands, he's very poor short-term memory, he's unable to feed himself, can't take care of himself, and needs others to perform the most mundane tasks. And that would include things like changing the TV channel, which he wants to have changed quite frequently, I might. So the Interior Government, through CCAC, provides 2 hours of support for us a day and a little less at the weekend. So as a result, we as the caregivers take on 90% in essence of Giles' support full time. Now, we were living in Calgary when this asthma attack occurred, and Giles was in hospital for 18 months. And as he was being prepared for release, we were given the option: you can go long-term care or you can take care of him yourself. And we elected the latter, recognizing that we would need to rearrange our working lives. We knew it was a big change, obviously, and we'd already gone through 18 months of some difficulty. In Calgary, we were fortunate because he was released into our care. Giles was given 8 hours of support a day through, in essence, CCAC there. He was also able to access RB, which is a brain injury facility in Calgary. So that a lot of the day-to-day matters, at least during the working day, were fine. But nevertheless, we recognized that long-term we would have a lot of changes in our life. And so I ended up giving up my job as a manager in an oil and gas company. My wife sold her business, and we changed our lifestyle. I became a consultant because we knew we would have to change radically how we would manage and live our lives. Now, while we were sort of sensitive to the issues that we were going to face, we could never really foresee the scope of what we had to deal with. And in essence, we underestimated them, to be fair. And very soon became obvious that we would have to move. We had a multi-level home, because Giles in a wheelchair, and the weather is not exactly conducive to raising someone or looking after someone in a wheelchair, or in just generally a head injury in Calgary. Even though there's lots of facilities there, it's a very difficult climate to raise someone. So we decided we would move. Now the move, the availability of a facility for Giles to attend when we moved was critical in our move and where we were going to move to and how to deal with that. I had to find a place where, as a consultant, I could work, and a head injury there of a place that Giles could access, and with a less harsh climate. That may seem like a lot of opportunities you would have through Canada, but believe me, it was a very difficult decision for us to where to move to and whatever. The upshot was we moved from Calgary to Ontario because I had work in Toronto. We couldn't find a suitable facility near Toronto. We looked in Oakville, looked in Mississauga, whatever. There were problems there in getting Giles in facility. And we came to London and found out there was a facility called Dale, and a possibility that Giles could access it. No guarantee, but a possibility. So we upped stakes and moved it, and that was in 1997. Now, Giles attends Dale 3 days a week, and this has enormous benefits for him and for us. He spends time amongst his peers, he interacts with others, which would not be possible if he spent most of his time at home. As part of the program, he goes to Parkwood, to the gym there 3 days a week, and he also goes to the YMCA, to the pool 1 day a week. And so as a result, I think he's healthy, he's engaged, he avoids the boredom that would occur if he was living at home, and generally he's, I think, a happier individual by going to Dale and getting the facilities and getting out into the community. For us, while obviously my wife and I are somewhat limited in what we can do, we arrange our lives so that one of us is always at home while Giles is there. But that is good because we can minimize through that process the sort of the financial and physical challenges that we have to go through as well. We're not getting any younger, as you appreciate. I've been able to continue my consulting work, which does involve, in some cases, quite a lot of travel. My wife can spend some time. She does, obviously takes care of the home, but she has time to build her interests and deal with that, which is helpful for her. And the general atmosphere, I think, at home is pretty good, given some of the stress and the strains that we go through. And I think it's really because we've been able to work a balance of Giles being out of the house, us being at home, and traveling around. I think beyond just the benefits that we get by Giles going to Dale, I think there's some society benefits. My wife and I really are productive members of society. We pay taxes because we're earning, or I'm earning anyway. We've got disposable income which can benefit other parts of society. We're also in a position, but because I'm working, I can put away some money, which ultimately, hopefully, will help offset some of the funding needs that Giles is going to need when we're no longer around, can't support him, whatever. We've also been able to maintain a pretty active and healthy lifestyle, I think. This has likely allowed us to take care of Giles longer than I think we would probably have said earlier on we would not be able to have taken care of Giles into the age that we currently are. And I think part of that is because we've been able to get this balance and because Giles can go out during the daytime. I think we'd be able to minimize perhaps the burden on the healthcare system to some degree for ourselves, and also by avoiding placing Giles into a long-term care facility. That's also added to a benefit the society has been able to gain. So I think in summary, it sort of goes without saying how appreciative we are of the ability of Giles being able to attend Dale has been a huge benefit for us and for him. And there is a significant benefit to society. If it supports and enhances institutions such as Dale for assisting those with serious disabilities, though the benefits may not be intuitively obvious, and hopefully some of the things I've said this evening will sort of help you garner some ideas of why these things are important and why I'd like to foster more of these sort of facilities to allow people with disabilities to attend. That's my 5 minutes worth. Thank you.